Hey everyone, this is Brianne Allred, physical therapist and pelvic health specialist, and I'm here today with Yada Yada. So today we're going to be talking about how to do a Kegel. I would say that almost everyone has heard of a Kegel in some form or another, but if you have been told to do them, very rarely does anybody ever teach you how. So the true way to really know how to do a Kegel is to have a pelvic floor specialist evaluate this. But I'm going to give you some tips and tricks and ways that you could possibly evaluate this yourself. When we're talking pelvic floor, these muscles really sit right around the vagina and the anus. So these areas are the only places that should be moving in your body. So if you're seeing your body rise and lower as you're doing each of these contractions, you're doing them incorrectly. The only thing you should really feel moving is the vagina and the anus, with maybe some tension down into the lower abdomen, lower pelvic region. So in order to do a pelvic floor contraction, I explain to a lot of my patients that I would like you to imagine that you have a blueberry at the opening of the vagina. Now, as that blueberry is sitting at the opening of the vagina, we would like your vagina to be able to grab the blueberry and pick it up so that there should be a closure and a lift of that area. Now the anus would be the same aspect of things this way, to where you could pick up the blueberry with the anus muscles. You will likely feel both the vagina and the anus move as you're doing these, regardless of where you are focusing that attention. But you can emphasize either a front passage or a back passage contraction. When you're doing that, another description that you could maybe look at if you're like, the blueberry thing's not working for me. I've heard some people really feel like they find benefit in the motion of thinking of how you suck a straw with your mouth and imagining that you're trying to suck a straw with your vagina or with your anus. So you're feeling that kind of movement of everything pull up and in. Now this is a small motion. I will often describe it as more like closing your eyes purposefully. You're closing the vagina and the anus purposefully. It is not a big grandiose movement. We really shouldn't see anything else moving. We don't want to see, using kind of my blink the eye analogy, we don't want to see everything smush up. We want it just to be a purposeful closure so that you're getting those muscles working and moving well. So that's how you do a correct Kegel. For other ways to assess, you can look at actually touching the opening of the vagina and seeing if you feel that closure movement, or touching the opening of the anus the same way. Some people find benefit with sitting on an exercise ball or rolling up a towel and sitting on it lengthwise. And they find a lot of benefit to be able to kind of feel increased sensation that way, and to be able to get more feedback if they're doing this correctly.